Mako is a system that was developed to help us perform the knee replacements with more precision. So it involves the use of a CT to preoperatively plan for the surgery and a robotic arm to allow us to execute the cuts in a very precise manner.
Mako works by first obtaining a CT scan of the patient's leg. Using that CT scan, we obtain a 3D model of the patient's specific bone. During surgery, we can use that 3D model. We map out the patient's bone and connect it with that 3D model. This technology allows us to position the implants and fine tune them specifically for each patient before we even make the first bone cut. One of the main benefits of the Mako technology is the accuracy that it gives us. We can plan our cuts and perform those cuts within half a millimeter and half a degree of accuracy. During surgery, it really helps us keep on line and on target so that we don't stray away from our original plan.
The Mako is proprietary for a company called Stryker, but we do have experience with other companies. So a lot of it depends on the patient in terms of picking the right implant for them. So from that perspective, even though the Mako is unique to Stryker, we use a variety of implants based on what the patient needs most. The Mako can be used for hip replacements. It can allow us to make more precise measurements, allow more precise placement of the implants, and allow us to do things like improve patients' leg length or work around deformities or pre-existing hardware. So similarly, all patients are candidates for the use of a Mako hip replacement, but there are a select kind of group of people who probably would benefit from its use more so than the average patient going through it.
It is not exactly a robot operating by itself. It's more of an extension of the surgeon's arm. So during surgery, I still have full control of the robot and I'm performing the entire surgery.
So any patient is a candidate for the use of a Mako knee replacement. Admittedly, it is probably a little bit more useful in patients who have sort of complex deformities where our traditional means of lining up the knee replacement may not work reliably or be possible. While everybody's not a candidate for Mako, that doesn't mean that a patient's necessarily going to do any worse if they do have what we refer to as conventional alignment measures. So the things that we typically use to help align a knee replacement haven't really been shown to significantly alter or worsen the outcomes for a patient in the short, medium, or long term when it comes to the use of robotics or not. Again, it's just another tool to help us do things accurately and really tailor the care to the individual patient in terms of what they need. Even though Mako is one option, if a patient's not a candidate for a Mako procedure, we can always use what we refer to as conventional instrumentation. Given that all of the MedStar surgeons that do joint replacement do them very frequently, we're all very skilled at being able to do that, and that's always our fallback. In some cases, patients may be a candidate for something called computer navigation. So while there's no robotic arm, we do use a computer to help us more precisely align the knee replacement or potentially hip replacement in order to do the surgery with as much accuracy as possible.